Outside of brain tumors, can sonophototherapy be an exclusive treatment, or do you combine it with other things? And then talk about if there's any side effects and what
Okay.
patients feel, during and after these treatments.
Okay. Very good questions. Outside of brain tumors, leukemias, there's no real
Sure.
tumors involved, right? So we
Mm-hmm.
don't use Sonophoto. Um, we always combine Sonophoto with other therapies
Okay.
because, it's not like when I started treating cancer in 1988 where we gave, B17
Mm-hmm.
coffee enemas and nutrition and we were doing great. Now, environment is more toxic, humans are more toxic, there's more stress, many factors in our nutritional food chain.
Mm-hmm.
So it's tougher, right? It's tougher. Cancer, like like bugs, like bacteria and other organisms are more resistant too. They have their innate intelligence too, so they
Mm-hmm.
try to bypass many things. So I don't recommend to just do monotherapies in the case of sonophoto, dynamic therapy, or IPT, insulin potentiation therapy, or anything like that. It's always in the contents of a complete systemic program addressing the 7 key principles that I mentioned.
Okay.
With respect to side effects, if you're doing natural therapies, I don't think that they're side effects. I think they're responses, right? That's a different, because the side effects is when something went wrong. You
Mm-hmm.
took a penicillin, you were allergic to it, you have a side effect. A response is what's happening to the sequential physiological changes from a tumor cell to a more benign tissue. And for this to go on, you have to have swelling. You have to have cellular debris going into your bloodstream and out, and into your colon.
Mm-hmm.
So as long as we're really detoxing, oxygenating, juicing, maybe rebounding, doing near-infrared saunas to limit the so-called Herxheimer reaction from cancer cell and pathogenic die-off. So as a doctor, I understand the question, because even if 1 out of 1,000 patients had a little rash from sonophotodynamic therapy sensitizer, we say that that could be a side effect.
Sure.
And throughout my 6 years of doing sonophoto, I think we've had 1 patient who had a mild rash, and that's when I injected the sensitizer directly into the breast tumor. But it was, temporary. It didn't
Mm-hmm.
affect the treatment. So I guess the answer to your question, Scott, is that we don't see any side effects per se
Okay.
with sonophotodynamic
Okay.
therapy.